with Rydberg. I'm the Director of Social Work and Counseling. Primarily my role is to oversee the work in the outpatient clinic. I've been with the program for just over 10 years, so I've been able to see it grow and develop. I would say there's a few things that I'm most proud of. Number one, the majority of people who engage in evidence-based treatment in the outpatient clinic get better, and those benefits are sustained over time. So they don't come in and get better and then have to come back. They come for treatment and they're able to sustain their benefits. A couple of the things that I'm really proud of, that is that we've earned the trust and respect of the veteran community. Service members and family members trust us, they respect us. So 95% of the people that we serve are very satisfied with the care they receive. And just over 90% of them also are willing to refer other veterans and service members and family members to our clinic, or have already referred people to our clinic. So the outpatient clinic is a little different in a couple of ways than the accelerated treatment programs that we have. We offer individual, couples, family therapy. We're able to see adolescents and children. We do a fair amount of couples counseling, like I mentioned. We offer care in person and virtually. And we offer a breadth of services. And there are other differences. Let's see. So the outpatient clinic also provides a breadth of services. And one of the primary differences is the pace at which people receive care. So in our accelerated treatment programs, they may be coming twice a day to see a clinician, where in our outpatient clinic, most of those individuals are seeing a therapist once a week, sometimes twice a week. They may engage in psychiatry and outpatient care as well, but it's a less frequent delivery of services. So all veterans, service members, and their family members are eligible for care. They need to be living in Illinois and Indiana to receive care through our outpatient clinic. So that's regardless of service era, discharge status, ability to pay. People who are a good fit for the program are individuals who do not need a higher level of care. So they're not needing to be in a residential program or even in an intensive program or an accelerated treatment program. They are also individuals who usually have PTSD. So 50% of the people that we serve in the outpatient clinic are suffering from trauma-related symptoms. Sometimes that's post-traumatic stress or subthreshold PTSD. We also treat depression, anxiety, lots of the other adjustment issues that veteran service members and their families face. We're not able to serve individuals because of the level of care that we offer who have like serious chronic mental illnesses. So people with psychotic disorders. We're not able to serve people who have a severe substance use or alcohol abuse issue, so we'll refer those people out. And if individuals have a really severe level of risk to harm themselves or others, those are also people that we won't serve in the outpatient clinic, and we'll probably refer to a higher level of care or a different program. So it's really simple to get involved in our care. So it's a phone call away. So you call our main number and you can talk with one of our intake clinicians or intake case managers, and they'll register you and get you scheduled for an intake. You can also do that through a secure message on our website. So you can go to roadhomeprogram.org and find our Get Care page and just enter your information there. So in the outpatient clinic for service members and veterans, we have a breadth of care. So we'll provide individual therapy, group therapy. It can also involve couples or families work if it's needed. There's many group psychotherapies that we run, including cognitive processing therapy. We also have an art therapy group. So that's what's unique, I guess, for service members. So the program has grown over the last 11 years. So we opened in 2014. Since then, we've served over 4,500 service members in the outpatient clinic and just over 1,000 family members and support people in the outpatient clinic. The vast majority of them do really well if they're able to commit to a full course of evidence-based treatment. And on a monthly basis over the past year, for example, we've served 400 people per month. So diversity is integrated into the outpatient clinic, number one, by having a diverse staff. So we have veterans, we have family members of veterans, we have people of diverse backgrounds serving in the outpatient clinic. We also integrate diversity questions, inclusion questions into our intake process. So we're asking people, do they have preferences for their clinician? Do they have preferences for the type of care they receive that would make it more accessible for them, more inclusive for them? We also offer a group that is specifically set up for people of diverse backgrounds. The Road Home program has been part of the community, serving service members and their family members to treat PTSD. I think prior to our programming and decades before, PTSD was a challenge to treat, but our program proves that PTSD is treatable, and that when people are treated and they're able to recover from it, they can go on to live purposeful, meaningful lives, living the lives they want to live. The other thing that I would say the program has impacted is significant for this community is that when we treat PTSD, when we treat depression in this community, there's a significant shift in their suicidality. So we see lower rates of suicide and suicidal ideation. And I think that's incredibly significant when we're working with this community.